Hello, my name is Brianna Tisa, and my presentation's on schizophrenia. And the meaning of schizophrenia is split mind or split reality. So some of the DSM-5 criteria includes 2 or more of the following symptoms during a 1-month period, and one of these symptoms must include one of the first 3. So that's delusions, hallucinations, or disorganized speech. And disorganized speech just means like incoherent or like a word salad or word jumble. And 2 of the other symptoms include grossly disorganized or catatonic behavior. And catatonic could be muscular rigidity. And then negative symptoms, which mean missing emotional expression, like we've said before. So another set of criteria is the level of functioning is disturbed, so they can't go on with their daily actions that they normally would. And the signs of disturbance have to happen for at least 6 months. And this is the DSM-5, so it's from the American Psychiatric Association. And more of the criteria is that schizoaffective disorder and depressive or bipolar disorder with psychotic features has been ruled out. And another one is that the disturbance is not due to physiological effects of substances, so it can't be because of drugs or things like that. And if there is a history of autism spectrum disorder or communication disorder of childhood onset, an additional diagnosis of schizophrenia is only made if there are delusions or hallucinations. And that's the DSM-5 as well. And so the empirical source that I found looks at how QT and P-wave dispersion affect a schizophrenia patient in comparison to a healthy person. And this is very important because a lot of schizophrenia patients tend to get cardiovascular disease, so it's a very important thing to study right now. And so they tested this by having 30 males with schizophrenia receiving treatment, and that was part of the patient group. And then they had 30 males with no history of diagnoses, and that was in the control group. So this was by Bicara et al. And they tested QT dispersion and P-wave dispersion. And the dispersion means the difference between the maximum and minimum on the electrocardiogram. So this is important to study because an increased QT dispersion leads to ventricular arrhythmia, and an increased P dispersion leads to irregular electrical transmission and atrial fibrillation. So some of the results for patients with schizophrenia, the QT dispersion actually more than doubled, which if an increased QTD leads to ventricular arrhythmia, then schizophrenia patients are way more likely to get that. And for the P dispersion, they didn't quite double, but they still had a very high amount compared to the control group. So for the popular press, I got my article from a girl named Nicola Hines, and she actually has schizophrenia, but this was sort of her reflection about how media portrays people with schizophrenia. And she said that a lot of headliners include things like paranoid schizophrenic, murders in cold blood, and like I said here, she said that you can mention that a person had schizophrenia, a crime happened, and there's a victim, and the public needs to be informed so that they could keep it from happening again. But she says that a lot of the times they just put that there so that it finds an excuse or something like that for the public so that they can use someone with schizophrenia as kind of a scapegoat for it. And so she actually says that research has shown that people with schizophrenia are more likely to be victims of crime than to actually commit them, which I thought was really interesting. And she says that we've seen it time and time again, the split personality shock twist. This is not schizophrenia, but it seems to be drilled into filmmakers' minds. So there's a huge misrepresentation about schizophrenia in social media, and they just use it as something to use a different movie aspect about it. And she says that stigma has delayed my recovery many times, because she said that a lot of people say schizo in a demeaning tone, and that takes away the self-acceptance that it's taken so many years for her to muster up. So that's from Hines, and these are my references.